have a big soft spot for posterior babies. I feel like they are so misunderstood. I feel like there are so so
Yes.
many misconceptions out there, and I feel like a lot of the things we are commonly told to both look for in terms of determining whether a baby is posterior, as well as a lot of the things that we are, especially as doulas, told to do if a baby is posterior, may not actually be the best way to support the baby in their way down and out. And I also love to think about it as supporting the baby in coming down and out as opposed to like fixing the malposition. I hate both of those words. Fixing and malposition, I'm always like, ugh.
Yeah.
But if we think instead about supporting this baby in their journey through the pelvis, that kind of, I think, frees us from a lot of that anxiety that we often experience when we think a baby is posterior. I like to think of posterior as a variation of normal. Sometimes posterior positioning can cause complications, but a lot of times babies who are anteriorly positioned have complications occur in labor. So I don't feel like it's fair to just say posterior babies are more likely to have these complications, which interestingly, I promise I won't go down this rabbit hole, but there is research out there that says posterior babies are more likely to have XYZ complications. But I always like to then look at it from a different perspective, which is how are we taught to manage posterior babies, and is our current are our current management protocols for posterior babies potentially causing or exacerbating some of the complications that we see more commonly?